Here on the Colour of Country Life Flow FM, we're speaking with Karen Price. She's the President of the Royal Australian College of GPs. Karen, how are you today?
I'm great, thank you.
We're speaking with you on the eve of a summit that we were actually discussing last week we felt needed to happen in Canberra about the situation with GPs and availability, particularly in rural and regional Australia. Why have you called this summit?
Well, we know that rural and regional Australia has been suffering for a long time. We know that it's very hard to find a doctor, and never mind a bulk billing doctor, and that means that there is a whole cohort of patients who find accessing healthcare in rural and regional communities very difficult. And that's going to translate to later presentations of more serious disease. It's going to be disastrous for that patient, and of course it's going to cost a lot more money. So we need to really rapidly turn this situation around. We have been calling on it for a long time, but it's really time critical now to actually deliver for Australia.
Now, this summit, like I said, we were talking about having something like this last week. It does seem to us that, like you say, these concerns have been around for some time. To what extent does this represent an escalation of, I guess, the concern leading up to, say, the federal budget?
Well, I just say there's only so long you can boil a frog before it jumps out of the water, and I think that's what's happened. We've been, talking about this for probably over a decade. We've had a terrible Medicare indexation. We've had a terrible Medicare freeze. We've had an awful pandemic, and that has all conspired to really put us now at a tipping point for general practice. We've had a Deloitte report which has shown that by 2032, if we keep going down this path, we're going to have 11,000 GP shortages all across Australia, and rural and regional Australia has been suffering this for a long time, but it's going to be everywhere. So we've got to do something. We've got to do it right now. The time for talk fests is over, really.
Now, the 50% figure I saw attributed to the college recently, that indicated that doctors believed it was unsustainable for them to keep practicing right now at the current level of funding?
Yeah, 50% of doctors think it's unsustainable to keep going at the level of funding that's there at the moment. 70% of practice owners think it's going to be unsustainable for them in the long term, and only 3% of doctors think there's any value in the Medicare rebate as it is at the moment. So 97% of doctors think the Medicare rebate does not match the cost of delivering high quality care. Now this is all about patient care. We want to be able to look after vulnerable patients no matter where they are, no matter how much they can or can't pay. So, we're trying to support them by making sure the government rebates the insurance that they can use to access that health care.
When it comes to general practice in general, it just does seem, has there been a declining number of medical graduates heading into this profession? Before we talk about doctors coming from overseas, have we seen a decline in the attractiveness to be a GP?
It's a great tragedy that one of the best careers in medicine has been whittled away, and it used to be 50% of the graduating class would choose general practice, but it went down to 15.2%, and our recent Health of the Nation survey has now shown that only 13.8% of new graduates have an interest in general practice. Now, this is an ongoing tragedy. So we have the pipeline leaking at all parts. We have the beginning of the pipeline. They have little interest. In the middle of the pipeline, the established doctors who we've invested in are now looking to do other jobs. And at the end of the pipeline, the older doctors are trying to bring forward their retirement. It really is no good when 70% of doctors are actually quite satisfied with the job. It's just the system has been created through years of neglect is not sufficient to be able to do that job.
And that's what's brought us in regional Australia to the need to, bring an overseas trained doctor. But the college has recently raised concern about the red tape surrounding even, say, bringing a doctor in from somewhere like Ireland. Seems to be an arduous process.
Oh, isn't it ridiculous? So, doctors from substantially similar countries like Ireland, trying to bring them in can cost many thousands of dollars, and I'm talking, $50,000, $60,000, $70,000, $80,000 to the practice, and then they can take 18 months to go through all the bureaucratic hoops. Now, it might provide jobs for bureaucrats, but it doesn't do what it needs to do in rural Australia, and that's got to change. It's just silly.
And to what extent will this summit, I know that it's a national summit for GP shortages everywhere, if I've got that right, to what extent will we be sure that there'll be outcomes sought from this summit that will be specifically focused on addressing shortages of GPs in rural and regional Australia?
Well, look, we've got all the data that shows us what the problems are. What we need now are the solutions, and we're going to deliver a white paper from this conference on the solutions for general practice.
And one of the controversial suggestions that an MP for the National Party in Northwest Victoria has suggested is that Medicare provider numbers might need to be used to actually compel graduate doctors to go out to a regional area. Do you think that sort of solution will work, or is it a sledgehammer to a P?
No, that's not a good solution because that will just drive that 13.8% down lower. There's a whole range of solutions we need to put on the table. And what we do want to avoid are those Band-Aid solutions that seem simple because they're often good, simple and wrong. And we can't have that kind of approach now applied to general practice. The GPs are the experts. We've got GP academics. We've got health economists and health system reformers in the room. We need to get some proper solutions and rather than just keep breaking what is already broken.
And the Northern Air Peninsula Health Alliance, they've put forward strategies which is effectively about putting more incentives and funding on the table to make it more attractive for someone not just to work as a GP in an area like theirs, but even stay in the town in terms of even living incentives. Are there those sorts of funding initiatives what might not be needed?
Well, they're part of a range of strategies. What we do want to look at is supporting more rural origin students to actually work in general practice so that they return to the towns where they live and they know. We want the rural towns themselves to have enough infrastructure to support to GP, so that includes childcare and good schools and all those sorts of things that rural people need. And we need the rural community to also have a wraparound support for that GP in the community, including that GP's family. So there's a whole range of things. We know if a GP trainee has a great experience from a great supervisor, we know they're more inclined to stay. We know if they have advanced skills like anaesthetics or obstetrics, they're more likely to stay. And we know the longer they spend training in rural areas, the more likely they are to return to it. So they're the sorts of things that we're looking at, but we've got to make sure that we've got the will and the way from the politicians to be able to deliver that sort of care.
Well, Karen Price from the Royal Australian College of GPs will watch the outcomes of the summit with great interest. Thank you so much for joining us today.
Thanks so much.